Mike McCool here. I'm in the Royal Examiner studio, and today with me is Walt Mabe. Walt is our chairman of the Board of Supervisors here in Warren County. And on Walt's mind today is COVID and the response that we've had and the uptick in cases and deaths that we've had here recently in the county. And what we want to do is kind of touch base on the things that are happening, things that we can do in our community to reduce our chances of catching it or spreading it, and just being safe. So Walt, what say you?
Well, I'm happy to be here first. One is, the biggest reason is public needs to hear what we believe is really happening. I am sure that there's an uptick. And when our district, we're the hot spot in our district. And the reasons to me are pretty simple, because one, we're seeing extra people that look at our beautiful leaves and they're bringing some of it to us.
Right.
We've got the schools that are open, and we've got young people that they may be carriers, but they're asymptomatic. So they don't even know. They may get a cold, they may get sniffles, they may get something, but it may not necessarily be COVID. But they are and have the potential to be carriers. We have more people that are not having their own personal protective devices with them and are not using them. The example that I can state is the mask. The mask is just a mask. Doesn't protect you. It protects the individual that you're talking to or the group that you're visiting. And if those people are wearing masks and talking back, they're protecting you. The mask doesn't protect the individual that's wearing it. We know that the COVID virus is smaller than the masks that we're protecting ourselves with. But when you get to talking or coughing, you're in with droplets or vapor or whatever. Your mask stops that, so because it can't go through. You can't always be pushing that COVID through the device all of the time. And if you're keeping it from getting into the open air, you're protecting the guy next to you or the girl next to you. They, in turn, when they talk through their mask, they're doing exactly the same thing. They're protecting you. Now, I am not going to be the one that says wear a mask. There are people that have honest health issues that would keep them. I mean, there are symptoms that are out there that just keeps you from wearing your mask. That's fine. But it's just a mask. If you want to wear it, wear it. If you don't, don't. But the idea is to try your best to protect the person around you. Second thing, and I'll rattle on all afternoon.
Hey, feel free.
Second thing, if you're feeling sick, go to the doctor. I mean, two of the biggest things are going to be temperature. And if it goes over, I think the number is 100.4. If your temperature is above 100.4, and you're having taste issues or smell issues, are you feeling cranky? Are you feeling...
That's normal.
That's like normal stuff, but it's flu-related type symptoms.
Sure.
You feel sick. Either stay home or go to the doctor. If the doctor thinks you're sick, he'll give you a test. If he gives you a test, he'll tell you what to do. Do it. If he tells you to go home and self-quarantine, do it. And when you as an individual and you have children and a wife and a grandmother and a father that's living in the same household, you're not just quarantining yourself, you're quarantining everybody. Because if you've got it and your kids or mother, father, brother, sister, uncle, they're visiting with you and they walk out, they're taking it with them. If they've been within 6 feet of you and they've been talking to you for more than 15 or 20 minutes, they probably have picked up something if you already have it.
Right, right. I think the big concern too is, when we're talking about this mask, that people say, well, they don't do any good, they don't. But I think what you hit on was we don't know if we have the virus because there's so many people that are asymptomatic or have just got it and they're still contagious, but they don't know it. Or they feel like, oh, it's just allergy, so I'm okay. So wearing the mask can do what you said, doing that. But like you said, it's just a mask.
It's just a mask.
But at the same time, if you don't have the mask on, I think we should still practice our social distancing.
Yes.
Wash your hands. Do things, because it's flu season as well. And we don't want to get the flu no more than we want to get the COVID. So I think that we need to make sure at this time of the year that we are diligent. Diligent. You got me all tongue-tied there, Walt. Art. Boy, I'm really messed up. Old people, they just... Anyway, but we do need to take that extra step. I just think we need to do that. And you're right. We got to be concerned about our families. And it's... it is real. People say, oh, it's, it'll go over. After the election, it'll go away,
Well, I hope the heck it doesn't.
Yeah.
From that point of view, because then we're skewing our election. I don't want to do that.
No.
It's not election related. It's a real virus. It's real. It's out there. And now, specifically, if we're increasing and our death toll is increasing and we have the ability to help stop it by doing the normal stuff that we should do. We should be doing it. 570 cases. That is a lot of cases. And people say, of course, you're going to get more positive cases when you're testing more. That's the whole idea.
Well, that shows you how many people were asymptomatic.
That's correct.
Because they didn't know.
They didn't know, and now they're being tested. And yes, there are more cases. But you can't tell me that people aren't dying. They could be dying from COVID, possibly. But they're probably dying because of a COVID-related type of problem. Somebody that has diabetes, or a lung problem, or a flu issue, and they got sick enough to go to the hospital, and they got COVID as well.
It'll push them over the edge.
It could push them right over the edge. That doesn't mean that COVID killed them. It means it was part of their original problem, and it didn't help.
Well, I think one of the things we want to stress, too, is that we don't want to live in fear of this virus. I mean,
Right.
We do know that, 97.5% of the people probably won't get it, or if they do get it, will survive.
It'll feel like the flu.
But we don't want to, make light of anyone that gets sick or dies from it. I mean, we don't want to dismiss that people could die from this virus or a
Right.
related situation. But at the same time, if we don't want everyone to just go home and sit in their house for the
No.
next year, because this is not something that's going to go away when the election's over.
Yeah.
And it's not going to go away in a month or 2 months. I think we're going to see a long, drawn out.
It's going to be a long
just
process.
Long process. Even with a vaccine, it's not going to be overnight a cure-all because vaccines aren't 100%, and it takes a long time to inoculate the population, to manufacture it. So, there's going to be a long period of time. So that's why I think it's important that we do take precautions. But I want to stress, and I'm like you, is please don't live in fear of the virus. I mean, there's a lot of other things worse than the virus, but at the same time, we don't want to get it.
We don't want to get it.
We don't
And
want to get it.
Our new normal is new everywhere.
Right.
I mean, it's new from the telemarketing or telecommuting perspective.
Right.
It's new from our kids having to do most of their work as a virtual student. It's new from me going out every day. And when I first go out, I wear my mask and I look at my group that I'm talking to. And if I can't be 6 feet apart and if I can't be comfortable, I wear a mask. I expect other people to do the same thing. Now, I do have a concern that our restaurants, those restaurateurs that are trying to protect us, they're serving food, and those people that are serving food, for the most part, I see them wearing masks. I would like to see them all wearing masks, but again, I can't force them to do it. I believe that there's more of a a governor's rule that says you will wear a mask if you're working in the food industry.
Yeah, and I see them. Of course, I support the local restaurants.
Absolutely, I do
and
too.
And I do see the waitresses wearing masks.
Right.
And they basically, the 99% rule, I think they've done a really good job.
They are. They're
and
doing
you can
great.
see that they've taken precautions with, sneeze guards and closing off sections and sanitizing everything when they rotate the tables through. I think people are, in the most part, are trying to do their part and trying to make things as safe as possible. I really believe that our community is doing that.
I believe that they're doing a whole bunch, and I believe that they could be doing more.
They're frustrated.
Yep.
But I think
You are right.
they're
People
all
are
in it
frustrated.
together, and I think people see that, and they're trying to stay in business, again, and not to live in this fear, but to try to adapt. But these are going to bring around opportunities for us as well. You mentioned the schools, commuting, and jobs. These will be future opportunities for our county and our community, I think, education-wise. All of a sudden, the system was kind of forced to embrace it a little sooner than later.
Right.
And so think about next year, the year after that, look at the opportunities that online learning has already done. I mean, my daughter finished her bachelor's degree online when she was in Malaysia, and she did her master's too while they were there. So all online. 5 years ago, that was next to impossible to do.
Correct.
So 5 years in the future, who's to say what it was? I got online the other day on the Hillsdale College and taking a class. They got them free. They're just saying, "Okay, come take these classes." So that's an opportunity, and that maybe didn't exist before COVID. So there's a lot of positive things that will change our life, and then we just need to take advantage of it, I think, going forward, and think about that.
Well, we're in a situation now to where our whole life has changed. I don't know of any one person that has been not affected by this. There are people that don't believe it, don't want to believe it, say it's election related. They can say anything they want, but when one person dies because of something we don't understand, we don't have a virus for, or we don't have a vaccine for, there's a problem. You can't fight it if you don't understand it. And we've got scientists all over the country, all over the world practically, that are trying to find a cure for it or a vaccine for it. They're doing what they can. But you've got to test it, you've got to grow it, you've got to distribute it, you've got to get it to the doctors or hospitals or nurses that's going to be doing this. And that's going to take some time. So frankly, we're in it for a long haul.
Right.
I've said that over and over and over. Be prepared to live in it for the long haul. And I'm not trying to be gloom and doom about it. We cannot bury our heads in the sand.
Exactly.
We just have to embrace the reality of a bad situation and see how we can fix it. And we need to communicate it over and over and over. And we need to figure out the best way for each one of us. Look out for your neighbor. I'm a veteran, and some of these old veterans that are in their houses, they are proud people. They don't believe that they need help from anybody. They're wrong. If you've got a veteran friend that you know of that lives in the house next door, give him a call, bang on his door, make sure he's okay. Make sure he's got food to eat, make sure he goes to the doctor, make sure. It's not, I'm just an old veteran that thinks about my veteran brothers and sisters. I worry about the kids that are constantly playing. And even though they may not get sick like we do, if they're playing around, riding their bicycles next to each other, if they're walking down the street all huddled up, there's a chance. Let's eliminate some of those chances and just be aware of the situation. It could go worse for us, or it could go better. I would love to be able to go out on any given day and see masks, not see people that aren't trying to protect me. Because if I wear my mask, I'm protecting you. So, in a nutshell, wear your mask. Wash your hands. If you're sick, go to the doctor. If he tells you to go home and quarantine, go home and quarantine. If you're telecommuting, embrace it. Because when it ends, you got to go back to work.
That's right, yeah.
You
Right.
got to run back up and down the road. Look for the opportunity that this has given us. Our county is still our county. It's still got its lovely rivers that you can still use. You can still hike. You can still drive around and look at leaves. You can still do all of the things that you could do. But you got to think about protecting those around you for now. Our normal is changing. Let's change with it. So, awareness.
And I
Be
think-
aware.
I think that's what it is. You know, you said that we're making these virus vaccines, and, you know, we're talking about government doing things and the state doing things and the county doing things, but really what it boils down to, it's an individual that's really going to make the difference.
Right.
You know, vaccines are great, but, you know, there's a whole movement. There's going to be a lot of people that won't take the vaccine.
That's right.
And so
I mean,
that'll...
a statistical number I've heard is about 43 or 47% of the people won't take a vaccine.
Right, regardless. Of
Regardless, whether
and,
it's
and
a
then
proven
you've got some
factor.
that says, well, a fast track vaccine, I'm still not going to. I'm going to wait and see if it kills.
I'm going to
them.
wait if it sees if
How
it
many
kills
people
you.
kill?
I'll try. Then I'll
Maybe
try.
I won't do it. Yeah.
Yeah, but
if you live, I might do it. Right.
If you
exactly.
live, I might do it.
Right.
I get that.
But I think it boils down to right now, it's going to be down to us individuals to do the biggest impact for this virus, and that is in the country. If we all do our part, you know, like you said, if the mask is something that you can wear, and like I like to quote out of the scriptures, don't cause a brother to stumble.
That's
you
right.
know? And I think that means we should be concerned about our fellow man and to say, you know, be something to be that to all people. You know, you can be a masked person to a masked person, be a non-masked person to a non, but practice careful social distancing, wash your hands, wear the mask, avoid crowds. And you did mention something about time limits, because I've been reading about, you know, the longer you're involved in it, the more exposure. Maybe you're going to be exposed, but you're going to be exposed a smaller amount. It's all cumulative.
Right.
So, you know, we want to reduce our exposure to things. We may be exposed to somebody. We hear that people said, oh, my friend got it, but I didn't get it. Well, you might have only been there for 2 minutes, and another guy was there for 2 hours.
Right.
So we want to be careful. Like you said, individualized care is really where we need to start, and start thinking about what I can do. It talks about our, you know, I always read, our rights end at the end of our nose, you know.
And that's the way that we work.
and-
I mean, I'm COVID. I'm concerned with food. I'm concerned with home ownership or the lack of security, transportation. I mean, the list can go on and
Endless.
on and on and on, and we've got to think about these things. It all starts on an individual level, so think about it. Keep safe.
Right.
Do what you normally do, but just be aware and be safe about it.
That's what we have to do.
Yeah.
Well, Walt's got a lot of topics to talk about, but today we're going to stay focused on this COVID thing, and if not, this thing will go on for hours. So
It could.
but
Believe
Walt
me,
will
it
be
could.
back, and you mentioned several topics. I know there's things going on with our food distribution
Yes.
and the school system. I know you're passionate about the food drives that we have, and that'll be a topic for another discussion. But be aware, there's a lot of that. If you know going on, there's no excuse to go hungry in Warren County.
That's correct.
And so, if that's a concern that anyone has, or you know someone that is financially unable to do that, please reach out to the DSS or to give Walt a call.
That's right.
But
You find somebody that's hungry and you can't help them, or you don't have the means to help them, call me. We'll get them food.
there's plenty of food in this
There's
county.
plenty of
so-
food right now.
And so that's something that we'll talk about some of these programs, schools. So I mean, Walt's passionate about helping our community, and I think we want to get the message out to people that there is help for us. But it boils down to, it's like you said, there's help out there, but you have to step up and ask, because we can't go door to door now. Do you need any help today? So, but that's what neighbors do.
That's what
And
neighbors
so
do.
That's
Get-
something.
you get involved in your neighbors. You talk about it. You discuss it. You become creative. A lot of the problems that we have as a government can be changed because communication and commitment and compromise, the three C's. But
Well,
people don't do it enough.
They don't do it enough, but I keep saying people don't care how much you know until they know how much you care, Walt. So,
Well.
and I think I keep quoting Zig Ziglar on that, but it's true that I know Walt and all of us do care about our community, but Walt is very passionate about it, and I think he's doing a great job as our chairman of the Warren County Board of Supervisors. And I know your fellow supervisors are right along there with you. And we've seen some major changes in the board this last year. And hopefully going forward, there's going to be changes on the town council. And I know that those changes hopefully will go together with yours. And we can really make our community a great place to.
We join our we join our commitment from the town and the county. We will have a better county. Because the town is part of the county.
The heart and soul.
The heart, yeah, that's right. There's a heartbeat there, and I can feel it. I just would love to see it join together to make for a better community.
That's what we're
because
at.
that's what we are, is a community.
Yeah. So if you haven't voted yet, you still
Get
have
out there and
time.
vote.
Open voting is going to go through Saturday, and then the polls will open back up on the 3rd. So it's important to participate. We just got the numbers of 33% of the county has already voted. And
That's huge.
we have 28,000 plus voters in our county, registered voters since the cutoff, and we've had over 9,000 already vote. And so that's a big turnout. 33% is pretty good. And I think we're going to have a record turnout this year.
7 days left.
7
Get
days.
out there and vote.
That's right. So again, Walt, thank you so much for coming in, sharing it. We are working on an interview coming up with Dr. Green from the Lord Fairfax Health
Yes.
District, and Rick Farrell, myself, and Walt. In the next few days, we'll be getting together and we'll be talking about it, maybe a little bit more on the district-wide and things that the district and the state are doing, and how we can drive that into our community, and how he might have some more insights and some new things.
I believe that he'll do a good job in informing us,
That's what we need to
answering
know.
the questions that we need, because there are lots of questions out there we don't understand.
Well, you know what, we hear that, like in World War II, and Franklin Roosevelt said, it's fear. Please don't be afraid. This too shall pass.
Right.
But be diligent and be responsible for your actions. And I think that's what we have to do.
Yep. We're individuals. We make up our own minds. We can do what we choose to do to protect ourselves and our families
That's it.
and our community. Thank you. I
all
appreciate
you
you
can
giving
do.
me the opportunity
Anytime.
to talk.
Appreciate it. Thanks again.
Yep.